Right, this is lab 4, the vessels lab. This is going to round out our cardiovascular system. This lab can be kind of confusing and fairly daunting just because the vessels are so minute. It's sometimes hard to tell the difference between one versus the other. So if you get frustrated with this lab, that's pretty normal. I wish I had better advice, but this one is just one of those you have to spend more time with it. I know y'all love hearing that, but that's kind of how this one works. So I'm not going to, luckily there is a great PowerPoint that you have access to that is going to be a very helpful study tool for this lab. So I'm gonna go through some of it, but I'm gonna basically get into the activity and make this one hopefully a little bit shorter than the lab 3 video. So you have on page 44 all of the different vessels that you have to know. Note that it has a little note, many arteries and veins share names. They have a left and right equivalent, so being able to make sure that you can identify left versus right, arteries versus veins, always being clear about that is going to be crucial for getting full credit in this lab. The other thing to remember, this is a general principle, and maybe this sounds basic, maybe some of you it's not, but what really helps me when I'm trying to just conceptualize learning all of these different arteries and veins is remember that arteries are going away from the heart, and as they go out towards the body, as they go more and more peripheral, they get smaller and smaller. So arteries are splitting as they're going towards the periphery, and veins are coming back together and they're joining and getting bigger and bigger as they come towards the heart. So vessels closest to the heart are always going to be larger, vessels farther away are going to be smaller, but just understanding that arteries are going to keep splitting and veins are going to join coming back towards the heart, and keeping that in mind, I think is very helpful in understanding not just trying to memorize the locations of these vessels, but actually how are they feeding each other, how are they draining different locations. I'm not going to get into any of those specifically because you do have this PowerPoint. So this is on Blackboard. In the lab 4 vessels, you have the assignment, the pages that are due, and then you have this thing called blood vessel model. This is just a great PowerPoint that has all of the arteries labeled for you. So it has all the vessels labeled for you. So as you go through it, it has very clear labeling about what is what. It breaks apart the celiac trunk, gonadal arteries, abdominal arteries. It goes into the veins, gives you all of these, hepatic portal circulation, everything. And then it lets you practice. So it will go through and it will let you practice with naming all of these. And so it has tons and tons of different slides, and then I think it even has, just some blank ones. It has lots of study opportunities. So make sure that you are using this to help you review these, not just learn them, but also review them. So I'm going to go through any of these. Hold on, let me just make sure. I think I want to look at this. So the hepatic portal vein, note it says drains the blood of the digestive viscera, organs, spleen and pancreas, and delivers it to the liver. The hepatic portal vein receives blood from the splenic vein, superior mesenteric vein, gastric vein, and inferior mesenteric veins. So your hepatic vein, starting with number 1, your hepatic vein, that is a regular vein, as you know, that is going to be draining blood from the liver and returning it into the inferior vena cava. So it's all the blood that comes to the liver, it gets filtered, it gets processed, and then it leaves the hepatic vein. You have 2 vessels that are going to your liver, though. One of them is not on here because it's you can still see it, the hepatic artery. This is the vessel that is bringing fresh oxygenated blood to the liver. The other vessel that's going to the liver is the hepatic portal vein, this number 2. So 2 vessels bringing blood to the liver, hepatic artery and hepatic portal vein. 1 vessel draining the liver, the hepatic vein. The hepatic portal vein is bringing deoxygenated blood, but that blood is nutrient rich because it's coming from the digestive organs. You know, it comes from the gastric, the splenic, and the superior and inferior mesenteric veins. Mesentery refers to the intestines. So you have this network of intestinal vessels and structures called your mesentery. In this case, we're talking about mesenteric veins. So after food is broken down, the nutrients are absorbed by those mesenteric veins and then brought into the portal vein. The superior and inferior mesenteric veins, yes, those, and this one. So these two, along with your splenic vein and your gastric vein from your stomach, are all going to join into what's called the portal vein, the hepatic portal vein. And again, that's going to bring blood to the liver, deoxygenated but nutrient-rich blood to be processed and to make bile and cholesterol and all the other liver things. So that's the liver circulation, or that hepatic circulation. Is there another one? The fetal circulation. So also in your book, if you don't see what you need, if for some reason, there may be one or two vessels that this PowerPoint doesn't have. Your book, starting with section 20.9 and going down through 20.12, will have all the vessels. And I promise all the vessels are in your book. You may have to, because it divides it up into sections. This is vessels from and to the heart. So it looks at head and neck, thoracic and abdominal walls, thoracic organs, GI tract, upper and lower limbs. So it's all here in your book. I promise all the vessels are there in your book. It just may not be on this one page. You might have to go looking a little bit. So just be aware of that. And that was, sorry, I saw the fetal circulation. That's what made me think of it. Section 20.12, I think, or something, 22.1 is fetal circulation. You have the pages that are due for this lab are pages 50 through 58. And with these, you're going to be labeling the flow of blood through vessels within the body. So I'm going to go through a couple of them with you just so you can see how these work. And then you can use this PowerPoint, your notes, to be able to do the rest of them, fill in the rest. Okay, so this is page 50. I'm just going to start with the first one. It wants you to label the vessels carrying oxygenated blood from the heart to the fingertips on the right hand. We'll see that this gets to be important because right versus left gets a little tricky sometimes. So from the heart to the fingertips, they have heart at the bottom, fingertips at the top. I'm going to flip it and just do heart at the top. So as blood leaves your heart, the first structure that it will pass through is the ascending aorta. After that, it goes through the aortic arch. And because we're talking about the right side of the body, we have to account for the brachiocephalic trunk. So blood is coming up through the ascending aorta, the aortic arch, and we're talking about the right side. So we're going to go through our brachiocephalic trunk. And because we're going to the fingertips, we're not going to go up the right common carotid, we're going to go out through the right subclavian artery. So from the aortic arch to the brachiocephalic trunk, and if you get confused about that, I like to break down the words. So brachiocephalic, brachio refers to the brachium, the upper arm. Cephalic refers to the head. And the brachiocephalic trunks, the vessels of the brachiocephalic trunks are the common carotid going up to the head and the subclavian going to the arm. So brachiocephalic, head and arm. From the brachiocephalic trunk, we go into the right subclavian artery. We're going away from the heart, so it's an artery. After the right subclavian artery, we're going to go through the axillary artery. From the axillary artery, it will go to the brachial artery. And in the brachial artery, it will split into the radial and ulnar arteries. And then from those, it moves into the fingertips. Something to note, the page says medial side of the right arm, medial side, lateral side of the right arm. So if we're talking about our right arm, the medial side from anatomic position, the medial side here is the ulnar side. So when you write yours, your ulnar should be on the part of the page that says medial, and your radial should be on the part of the page, that box that says lateral. So the two. And this is essentially how this kind of works. You start with the heart, and you just follow the blood through these vessels all the way out to the fingertips. I believe the next one asks you to do your left side. It's fairly identical. Just remember that on the left side, you have the ascending aorta, the aortic arch, and then there is no brachiocephalic trunk. You can go right up through the left subclavian artery. So that's going to be the biggest difference between the right and the left for that circulation pattern. Let's look at page 52. So carrying deoxygenated blood from the fingertips to the heart. So now we're going from the periphery out here back in. Which side? Let's see. Okay, here we go. Sorry, I was being lost. We start at the fingertips. And this is veins. So these again are going to be merging together. That's why when you look at these arrows, you see all the boxes merging together. So from our fingertips, we're going to have vessels from the ulnar. Let me do this correctly. So this is our lateral side. So this will be the radial and ulnar veins. Radial vein, ulnar vein, medial side, coming together. And they're going to form your brachial veins. Note it says that you want to use the median cubital in this activity, your brachial veins. Your brachial vein and your basilic vein are going to join together, and they're going to make your axillary. Your axillary vein and your cephalic vein, they join to make your subclavian vein. Your subclavian feeds into your brachiocephalic vein. This is not the same as the brachiocephalic trunk. From the brachiocephalic vein, those empty into the superior vena cava, which sends blood to the heart. Again, we can start these small vessels of our fingertips. Those start to join and coalesce into larger and larger veins that run up the ulnar and the radial side. Those are going to join into the brachial veins. The brachial and the basilic join together, cephalic and axillary, up to the subclavian, brachiocephalic vein, into the heart. These can be very frustrating, but once you start to get into the groove of it, and I think with this PowerPoint, hopefully it's at least doable and not too much of a headache. But again, always send me your pages if you have questions, and I will help you through this. Part of the reason why, especially if you do make an appointment with me or email me and ask me the questions, I tend to really give you the answers. Part of the reason why I don't just give you answers right now is because I want to make you contact me and spend time and put in that effort, because it does make a difference in learning if you actually reach out to me and try to get the answer versus just watching this video and copying down what I say. So if you are worried about your lab grades and getting these pages filled in, just every week set aside 30 minutes to meet with me, and I'll tell you if you're right or not. I will give you the answers pretty much. I just want you to spend that time. Okay. Let's see. Let's do 53. Yeah. I'll do 53, that's the last one I'm gonna do. So page 53, mapping blood flow to the upper legs from the heart down the body. So if we start up here at the heart, again, we're going out. So we have to talk about the ascending aorta, arch, aortic arch. This time, we're not going to the head, we're not going to the arms, we're going down the body. So we're gonna come up the, around the arch and then down the descending aorta. So you can split this into different sections. You have your descending thoracic aorta. And then after it crosses the diaphragm, it becomes your descending abdominal aorta. That's just breaking it up into different sections. You don't have to label it as descending because it's just obvious. If you have the basic anatomy knowledge, you know that the thoracic aorta and the abdominal aorta are only going down, they're not coming up. But it's just, again, being that extra level of specificity you can put in there. Okay, so I'm gonna do it this way to the left. So I'm going left, and then shoulder to plana, that's gonna get confusing. We'll just do it this way. Left, right, and left. Okay, so from the descending abdominal aorta, it splits into the right common iliac artery and the left common iliac artery. These are going to follow each other exactly, so I'm just going to kind of follow one of them. The right common iliac splits into the external and internal iliac arteries. External iliac artery. The internal iliac artery, at this point, it's going to go in towards the abdominal organs, in towards, the peritoneal organs, and feed your reproductive structures, urogenital structures rather. The external iliac is going to go down towards the leg. The external iliac becomes the femoral artery. The femoral artery will turn into the popliteal. And when I say that it becomes the femoral, that it turns into the popliteal, what's happening is that you have this one main artery, and then other ones are branching off of it, and as they branch, that main artery turns into something different. We call it something different. So when we look at a blood vessel model, get into you do this. This is basically the one that is on that PowerPoint. You have your abdominal aorta right here. It splits into your two common iliac arteries. You can see that little one right there, that internal branch, that's the internal iliac. This longer one is the external iliac. And then you have things that split off of it. So once something splits, it becomes the femoral artery. And then you have some more things splitting. We have the popliteal artery. And then it goes down and becomes these final ones, into the tibial arteries. So the popliteal, it will split into the anterior tibial artery and posterior tibial artery. Popliteal, your popliteus is the back of your knee. That splits into an anterior and a posterior tibial arteries. And that's all I'm going to do, because when you're coming back, the page 54, it's pretty much exactly the same, although you do have to add in one. I'm not going to say it, I'm going to let y'all figure it out. Or contact me. Ooh, you know what? Let me do 56, because that one is confusing, even with the help of pages, the PowerPoint. Okay, so 56, this is mapping intestines to the heart. So from the intestines, remember the intestines are filled with nutrients. No oxygen, it's oxygen poor, but it's nutrient rich. So once that food gets broken down, the column gets broken down, all the nutrients are absorbed in the small intestine. It's going to gather those vessels that are absorbing things and bring it to the liver. So your intestines, we have over here the inferior mesenteric veins and the superior mesenteric veins. And then your inferior mesenteric feeds both into your superior mesenteric and your splenic veins. You have all of these joining together to form your portal vein. The portal vein splits once it gets into the liver and becomes hepatic veins, which drain into the inferior vena cava, which leads to the heart. So just to recap, blood from the intestines is gathered in the inferior mesenteric, superior mesenteric, and splenic veins. They all join together to form the portal vein. The portal vein is taking oxygen-poor but nutrient-rich blood to the liver, where it splits and becomes all of those little hepatic veins. And here you go. Here's a nice one to see. You have your portal vein. Typically, the portal vein is purple because it's got mixed, it's just considered mixed blood, and so usually they say mixed blood is purple. So you have the hepatic artery in red, the hepatic portal vein coming from the intestines. It splits out and it goes into the liver lobules, so all that blood can be processed, and those all gather back up, form into these hepatic veins, which turns into the inferior vena cava and goes to the heart. Right. I'll let y'all work on the rest of them. The ones with the mom with the placenta, doing the brain. Again, your book and that PowerPoint will be most helpful for you. And I'm doing this all.